everyone, my name is Marissa Vissi and I'm an occupational therapist here at Gateway Rehab Hospital. So since April is National Occupational Therapy Month, I'd like to touch base on some of the things we focus on as occupational therapists, specifically with patients that have a spinal cord injury. So one of our main goals as occupational therapists is to work with patients to increase their independence with meaningful activities that they enjoy doing. So often at Gateway, we're focusing on activities of daily living, which include feeding, dressing, bathing, and toileting. So after someone's had a spinal cord injury, they may have increased difficulty with these things. So as an OT, we often focus on adapting the task for the patients, as well as teaching compensatory strategies to increase their independence. So I have some items here that we can look at. So for example, for feeding, if someone's having difficulty, we have something called a universal cuff. So this is for patients that maybe have decreased dexterity or range of motion in their hands and their upper extremities. So with the universal cuff, the utensil just slides in and you put it around your hand, and then you can use that to scoop and bring to your mouth. This is a more supportive universal cuff if they need wrist support as well. There are built-up utensils that we use, and also extended utensils. So if someone has decreased range of motion and they can only bring the fork up to here, we see that as extra length so they don't have to bring their arm up as far. Not only do we focus on activities of daily living, we also focus on instrumental activities of daily living. So that can include meal prep, cleaning, laundry. So for meal prep, we have something here that we can use. It's just an adaptive cutting board. So you can put like a potato or an apple there. You don't need two hands to hold it because the nails will hold it. And then this is something called a rocker knife. So if you have decreased dexterity or range of motion or even strength in your hands, you can use the rocker knife to cut versus needing two hands for that task as well. So in addition to the adaptive equipment or the compensatory strategies that we teach, we may, as someone comes in and they're having decreased ability to do something, we may increase the amount of time, the amount of help that we are giving. So if someone needs help to bring their hand to their mouth, we may be giving hand over hand, and it over time as they get better, we are decreasing the amount we are helping so that they're doing more work. So with that, our goal is also to optimize the upper extremity function and prevent deformities. So one thing we may focus on is creating a splint or an orthosis. So this is just an example of a resting hand splint to prevent contractures in someone's hand so that as they regain movement and function, their hand will be in a functional position instead of contracted, meaning their joints are locked in a certain position. Another important thing that we focus on here at Gateway with patients with spinal cord injury is, in conjunction with nursing, establishing a bowel and bladder program to increase independence with toileting and also decrease the risk of complications from having issues with incontinence or bowel impaction. As an OT, my most important thing that I like to focus on is what's important and meaningful for the patients. And that's kind of what makes OT fun. So for example, I had a patient that was having difficulty when she first came in. She couldn't use her arms at all, just even sensitive to touch. It was painful. So we incorporated different things that she enjoyed doing. So one of the things that she really liked was painting, and that was one of her hobbies at home. So in order to incorporate fine motor coordination task and increasing her function with her upper extremities, she actually created this painting here that I keep at my desk. So that's a good reminder, and that's really what I love about OT, because we can make it fun for the patients. So once again, April's National Occupational Therapy Month, and so just wanted to highlight that for you. You can check us out at our website.